This is Debbie Bucher, and this is the lecture for the LPN to RN Transitions course for Parkland College. And this is Chapter 6, Providing Patient-Centered Care Through the Nursing Process. And a historical perspective is 1955, the nursing process. Lydia Hall introduced observation and administration of care and validation. 1958 to 1961, Orlando introduced the three-step nursing process of assessment, planning, and evaluation. 1967, Eura and Walsh developed four-step nursing process. This included assessment, planning, implementation, and evaluation. And in 1973, the ANA added the fifth item to the nursing process, the diagnosis. In 1991, the ANA introduced the outcome identification. So the six steps of the nursing process today are assessment, diagnosis, outcome identification, planning, implementation, and evaluation. And the nursing process is a method of critical thinking that concentrates on resolving or solving patient problems in professional nursing practice. The nursing process is a systematic, rational method of planning and providing nursing care. It also helps to identify a client's healthcare status and actual or potential health problems, and to establish plans to meet the identified needs and to deliver specific nursing interventions to address those needs. The nursing process is generally defined as a systematic problem-solving approach towards giving individualized nursing care, and it is the foundation of nursing profession is the nursing process. And we use the nursing process to help us think critically about the patient's plan of care. And the nursing process has the following characteristics. It is a framework for providing nursing care to individuals, families, and communities. It is orderly and systematic. It is independent. It provides specific care for individuals, families, and communities. It is patient-centered, using the patient's strengths. It is appropriate for use throughout the lifespan, and it can be used in all settings. Assessment is the first step and involves the collection of both objective and subjective data about an individual, family, or community. It examines the five realms of psychological, physiological, social, cultural, and spiritual. An assessment is completed by various mechanisms. The nurse observes the patient and the surrounding situation, interviews both primary and secondary sources such as the patient and their family or caregiver. The nurse also does a head-to-toe physical assessment and interprets the laboratory data as well. The assessment phase is the foundation for deciding the correct nursing diagnoses, planning, and interventions. We need to assess the patient for a holistic assessment with the patient's and patient's family or caregivers. And we also need to address the psychological, socioeconomic, and spiritual aspects that play a very important role in not only the patient's ability to access health care, but helps to drive the plan of care as well. And then assessment, you have objective data and subjective data. The objective data information that observes little room for interpretation, facts that can be measured and verified, and examples of objective data is vital signs, the size and location of a wound, and color of drainage. Subjective data is information experienced and described only by the patient. It cannot be verified as to its characteristics or easily quantified. Examples are feelings and experiences of the patient's pain, fear, nausea, and uneasiness. It is important that we obtain a thorough health and medical history, and we use open-ended questions to help you assess the patient. Very important. And we will form the nursing diagnosis, the clinical act of identifying the problems, and registered nurses are educated and licensed to make nursing diagnosis, just as physicians are licensed to make medical diagnoses. And the nursing diagnosis is different from the medical diagnosis in such that the patient is a partner with the nurse in the diagnostic process, and the process involves clue clustering, including listening, collaborating, communicating, being an active listener, and communicating, including clear, descriptive, and accurate documentation. Also, you want to see what the patient would like to accomplish, identify expected outcomes, and create a plan to achieve those outcomes, implement the plan and assign others as well as to implement it within your interdisciplinary team. And then, of course, you want to evaluate the effectiveness. So there are 6 phases or steps that are dynamic and flexible. You will need to organize and prioritize care, keep the focus on what's important, the patient's health status and quality of life, as well as form thinking habits that help you gain confidence and skills that you need to think critically in the clinical setting. And different ways that you can assess data collection methods are interview, observation, and physical assessment. Very important. And all the information gathered helps to formulate the plan of care. So, and even including your subjective information and your objective information. And we do use here at Parkland the Gordon's Health Patterns, and there are 11 categories of functional health patterns that make a systematic and standardized approach possible. The 11 categories identified by Gordon are health perception and health management, nutrition and metabolism, elimination, activity and exercise, cognition and perception, sleep and rest, self-perception and self-concept, roles and relationships, sexuality and reproduction, coping and stress tolerance, and values and beliefs. So very, very important. And this also is a very good tool to use when you're doing your assessment and collecting your assessment data. It does really work out quite well. Now, Virginia Henderson, the 14 needs of the individual include breathing, eating and drinking, eliminating, moving, sleeping and resting, selective clothing and dressing, regulating body temperature, maintaining adequate hygiene, remaining free from harm and avoiding harming others, communicating, learning, and seeking general fulfillment, having spirituality, working, and playing. Henderson believed that people both ill and well had nursing care needs in order to maintain balance achieved by attending to the 14 basic needs. This holistic approach assesses the biological, psychological, sociocultural, and spiritual needs of the individual. Both of these methods will assist you in identifying dysfunctional patterns. Organization of data is important. It must be organized in a clear, systematic manner that permits logical progression of the data. And you want to validate your assessment data. Validating or verifying assessment data is necessary to ensure accuracy. Organized data helps to formulate the plan of care and prioritize nursing diagnoses and interventions. The data needs to be organized to help formulate the plan of care. You also need to prioritize nursing diagnoses and interventions. The assessment needs to be well documented to be able to communicate clearly with other disciplines and as well as the healthcare team to provide the best patient care. You also may want to compare data to see what you are seeing as a nurse versus what you are hearing the patient telling you, which will help to provide accuracy. Question: a nurse collected the following data. Which data are subjective? And it would be number 4, the patient is nauseated. That is an example of subjective data. Nursing diagnoses, you need to cluster cues or data points gathered in the assessment to help define care priorities and associated problems or nursing diagnoses. Every nursing diagnosis must be substantiated by identifying criteria or defining characteristics. Diagnoses may be actual, potential, or wellness. And the problem, etiology, and signs and symptoms format, you have the problem, which is from the North American Nursing Diagnosis Association, or NANDA, that gives you your different nursing diagnoses. Etiology is the cause as evidenced by, and then signs and symptoms are your defining characteristics, so your objective and subjective data. So the nursing diagnosis may be written, spiritual distress related to death of husband as evidenced by tearfulness and subjective comment, why did God let this happen? Nursing diagnosis will also include collaborative problems. They are problems that require collaborative interventions with the physician and the healthcare team. With collaborative problems, the nurses monitor the patient to detect changes in status or for the onset of complications. An example would be decreased tissue perfusion in the left lower extremity. The problem statement is not written in terms of a nursing diagnosis, but shows a collaborative effort by the members of the healthcare team to treat and monitor this problem. So the medical diagnosis is pneumonia. The nursing diagnosis is ineffective airway clearance related to thick tracheobronchial secretions. The patient needs oxygen as well as a procedure of a bronchoscopy and also oxygen therapy. So first write down the symptoms the patient is having, such as shortness of breath when walking short distances. The patient states his heart is racing and heart rate is 110 beats per minute. Needs subjective and objective data. Subjective data is patient stating he is short of breath and heart is racing. Objective data is heart rate is 110 and respiratory rate is 32. And poor eye contact, increased hand and arm movement may be anxiety. So every nursing diagnosis needs to be substantiated or supported by identifying criteria. And the identifying criteria must be present in that patient to assign that nursing diagnosis. And most patients will have multiple nursing diagnoses. And again, you'll state your problem and then the related to and then the as evidenced by. Ackley and Lagwid 2006 suggests 5 steps to help formulate a nursing diagnosis, which I think is very helpful. Number 1, you want to highlight or underline the relevant symptoms. Number 2, you want to make a short list of the symptoms. 3, cluster similar symptoms. 4, analyze or interpret the symptoms. And 5, select a nursing diagnosis label that fits with the appropriate related factors and defining characteristics. So the nursing diagnosis needs to support what the main medical diagnosis is of the patient. So there should be a correlation there. And it's important to use data to help to individualize the plan of care. And again, nursing diagnosis includes the problem, etiology, and signs and symptoms. The etiology includes what causes or contributes to the development of the problem, which is relating to the feature, and the signs and symptoms are the defining characteristics that also refer to the problem, and they are cited by objective and subjective. When you are looking at your nursing diagnoses, the other thing you need to keep in mind is you need to prioritize them. When prioritizing nursing diagnoses, the most critical problems receive the highest priority. And using Maslow's hierarchy of needs, importance is first given to physical needs, and safety is also a priority. And again, the most critical problems that you come across need to be prioritized for the best outcomes for your patient. Outcome identification, it can be either immediate, intermediate, or long-term goals that are identified with the patient and family. Outcomes need to be specific, realistic, measurable, and written in positive, patient-centered terms. Every nursing diagnosis is associated with specific, individualized, expected outcomes. Outcomes must be measurable and clearly communicated along with signs of attainment or non-attainment with dates and times for evaluation. An example is patient's pain will decrease or to less than or equal to 2 on a 0 to 10 pain scale by a certain date. So again, you need to prioritize the nursing diagnoses, make sure your outcomes are specific, measurable, and achievable, and then you need to assess to see if your outcomes were met. An example of a good outcome too is patient will ambulate 100 feet by the end of clinical by a certain date. And there are three different nursing diagnoses types. They are the nursing diagnosis with the three steps of the nursing diagnosis, the related to factors or the etiology, and then lastly the defining characteristics, which should include subjective and objective. Risk nursing diagnoses, you will have the diagnostic label with the risk factors, and then wellness diagnoses are just state the nursing diagnosis. And again, outcomes are immediate, intermediate, and long-term. And again, specific, measurable. I think this seems like maybe it's almost duplicate of the other slide. So again, they just need to be specific and individualized in order to be able to evaluate whether the patient is meeting the outcomes or not. So outcomes identifications. There is the Nursing Outcomes Classification, or NOC. They are grouped into 32 classes and 7 domains, which includes functional health, physiological health, psychosocial health, health knowledge and behavior, perceived health, family health, and community health. And it defines outcomes that focus on patient, identifies risk adjustment factors, and prioritizes measures for comprehensive outcomes that respond to nursing interventions and can be used by nurses in all settings. Every nursing diagnosis is supported by outcomes or expectations that are specific, individualized, and expected, and they could be measured very, very objectively and clearly with signs of attainment or non-attainment. Very important to individualize this in your plan of care. So planning, you're including goals and outcomes as well as planning interventions, and the plan of care is developed. Identifying interventions needed for the patient to regain a level of independence. Establishing an outcome priority is a planning mechanism involving mapping out specific individualized nursing actions that aim to achieve the desired outcomes associated with the nursing diagnosis. So everything is related. Your interventions, your planning, and your interventions need to support the outcome. If they don't support the outcome, then there is no way your patient is going to be able to achieve that outcome. So your interventions must support meeting that outcome, and then your outcome must support why it is you chose it as a nursing diagnosis, and then your nursing diagnosis must relate back to the medical diagnosis. What is the main medical problem? And that from that you are deciding what your nursing diagnoses are. So interventions need to be related to the nursing diagnosis as well as supporting and meeting the patient outcomes. Very, very important to remember that. And then nursing interventions. Nursing interventions classification, or otherwise known as NIC, contains 554 nursing interventions grouped into 30 classes and 7 domains. And the domains are basic, physiological, behavioral, safety, family, community, and health systems. Each intervention is coded and linked with NANDA, the nursing diagnosis. An example: performing prompt and comprehensive assessment and management of pain, including location, characteristics, onset and duration, frequency, quality, intensity, and precipitating factors. So interventions need to be related to the nursing diagnosis as well as supporting meeting the patient outcomes. And the intervention should help the patient be at a level of independence at or a higher level before admission to the facility, or at least back to their baseline level. Implementation is carrying out the plan of care, which requires a multidisciplinary approach. RNs serve as gatekeepers and are responsible for delegating and coordinating care, implementing advanced interventions, evaluating and updating the plan of care and associated outcome priorities, engaging in and documenting patient-family education, documenting care, and retaining full accountability that the plan of care is carried out in a sensitive and effective manner. So the RN is essentially the overall gatekeeper of the plan of care, and the RN helps to organize care and interventions for the interdisciplinary plan of care. Evaluation is a process of examining the effectiveness of the plan of care and adjusting to it, ultimately meeting the needs of the patient. Outcome achievement is only part of the evaluation. Assessment and evaluation occur simultaneously and continually. RNs interpret the data and adjust the plan of care to best meet the patient's needs. The plan of care may require no changes if the patient's condition is progressing and as expected. Concept mapping or care plans is a visual representation of the client's pathophysiology, treatments, and nursing needs. It demonstrates relationships and data and aids in analysis and meaning making and helps prioritization, determination of outcomes, as well as the interventions. Next is a picture of the concept map, and you can see in the center is an elderly man. He has COPD. He states he feels tired all the time. You detect a racing heart rate. He is wringing his hands looking out the window, which you're observing, and he states, "I can only walk short distances." So if you want to do this on a patient of yours, step number one is you fill in the middle circle with the medical diagnosis. Again, everything goes off of that main medical diagnosis. That's very important that you're identifying the main medical diagnosis to formulate your nursing diagnoses. So step number two, you need to look up relevant nursing diagnoses, place one per circle around the diagram, and then add the patient data to each circle where it pertains. Step number three, number the circles in order of priority. Again, it's very important that we prioritize. Step number four, create a table that lists interventions for each nursing diagnosis. And step five, write patient responses to interventions and evaluation of data and progress towards goals. Question: a nurse is developing an individual care plan for the patient. Which step of the nursing process is the nurse using? And if you answered one, planning, that is indeed correct. And lastly is just a diagram of the nursing process, which includes your assessment, nursing diagnosis, outcomes, planning, implementation of your interventions, and then lastly but not least is evaluating, did your patient meet the outcomes? And if not, what do we need to do about going about and changing that plan of care so that we can get a positive outcome for our patients? So this now concludes the lecture on the nursing process, Chapter 6 in your Claywell text. Thank you.